Ever wondered why you feel so tired even after a full night's sleep? Today, we unravel the mystery of fatigue. Let's start by defining fatigue. It's not just about feeling drowsy or worn out. Fatigue is a persistent sense of tiredness that interferes with your everyday activities. It's a complex condition that can be both physical and mental in nature. Physical fatigue is when your muscles can't maintain optimal performance. You've probably felt this after a strenuous workout or a long day of physical labor. It's that feeling when your body screams for a break, your muscles ache, and you feel like you can't take another step. Mental fatigue, on the other hand, is less about your body and more about your brain. It's that feeling of brain fog, where concentrating becomes difficult and even simple tasks seem daunting. Mental fatigue can leave you feeling emotionally drained, impacting your mood and motivation. Now, fatigue can be acute or chronic. Acute fatigue is temporary, often tied to a specific cause like a late night or an intense workout, and it usually resolves with adequate rest. Chronic fatigue, however, is a different beast. It's a constant, relentless tiredness that doesn't go away with rest. It can last for months, even years, and can be a symptom of various medical conditions. Underneath the surface, fatigue is more than just a feeling. It's the result of intricate physiological processes involving adenosine, a chemical that accumulates in your brain during wakefulness and promotes sleep, and neurotransmitters, chemical messengers that transmit signals throughout your body. The central nervous system plays a key role in fatigue, affecting both muscular and mental performance. If the system is out of balance, it can leave you feeling perpetually worn out, regardless of how much rest you get. So, fatigue is not just about feeling tired, it's a complex phenomenon with multiple layers to it. Fatigue is a common symptom in various medical conditions, but what's happening inside our bodies? Our bodies operate like well-oiled machines, and fatigue is akin to that red blinking light on the dashboard, signaling that something is amiss. Behind this seemingly simple sensation of tiredness are complex physiological mechanisms at play. Let's take a deep dive into what's happening inside our bodies. When you experience fatigue, your body is essentially responding to a signal from your brain. This signal is mediated by certain chemicals, including adenosine and various neurotransmitters. Adenosine is a substance that accumulates in the brain during waking hours, leading to a decreased neural activity and ultimately, the sensation of tiredness. Neurotransmitters also play a crucial role. They are the chemical messengers responsible for transmitting signals in the brain and other areas of the body. When neurotransmitters like serotonin and dopamine are out of balance, fatigue can set in. Serotonin has a calming effect and promotes sleep, while dopamine is involved in regulating mood and pleasure and plays a role in maintaining alertness and motivation. The central nervous system, the body's command center, has a significant impact on both muscular and mental performance when fatigue strikes. Physically, the central nervous system impacts muscle recruitment and coordination, leading to a decline in physical performance. Mentally, it affects cognitive functions such as attention, decision-making, and reaction time, all of which can be compromised when fatigue sets in. The intricate interplay between these physiological mechanisms underscores that fatigue is not merely a lack of energy or sleepiness. It's a multifaceted process that involves various systems within the body, from the chemicals swirling in our brains to the central nervous system's command signals. As we've seen, fatigue is more than just feeling tired, it's a complex physiological process. Now that we know what's happening inside our bodies when we're fatigued, let's explore some common causes. Fatigue is not selective. It can stem from a multitude of sources, both physical and psychological. Sleep deprivation is one of the most common culprits of fatigue. When we skimp on sleep, we deny our bodies the opportunity to rest and regenerate, leading to a state of constant tiredness. Then we have anemia, a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues. This lack of oxygen can leave you feeling tired and weak. Chronic diseases too can be a source of fatigue. Conditions like diabetes, heart disease, kidney disease, and thyroid problems often come with fatigue as a sidekick. However, fatigue is not just about physical health. Our lifestyle choices, work-related stress, and dietary factors can also play significant roles. For instance, leading a sedentary lifestyle with little to no exercise can make you more susceptible to fatigue. Our bodies are designed for movement, and without it, our energy levels can plummet. Work-related stress is another key factor. When we're under constant stress, our bodies are in a perpetual state of fight or flight, which can be exhausting. Our diets can also impact our energy levels. Consuming too much sugar or caffeine, for example, can lead to energy crashes. On the flip side, not getting enough essential nutrients can leave our bodies struggling to function properly, leading to fatigue. So as we can see, fatigue is a complex issue with many potential causes. It's not just about being tired, it's about understanding why we're tired. And by understanding the causes and risk factors of fatigue, we can better manage and prevent it. When fatigue persists, it's important to find out why. Let's explore some diagnostic tools. To uncover the root cause of fatigue, a variety of tests and investigations may be necessary. One of the most common and straightforward diagnostic tools is a blood test. Blood tests can reveal a multitude of potential causes, such as iron deficiency, anemia, thyroid disease, or even signs of chronic diseases, all of which can contribute to fatigue. In addition to blood tests, sleep studies are another crucial tool in the diagnostic process. These studies can help identify conditions such as sleep apnea, restless leg syndrome, or narcolepsy, which disrupt the quality of your sleep, leaving you feeling fatigued during the day. A sleep study typically involves an overnight stay at a sleep center, where specialists monitor your sleep patterns, breathing, heart rate, and more. But fatigue isn't always about the physical. It can often have psychological roots. That's where psychological assessments come into play. These assessments help identify mental health conditions, such as depression or anxiety, that could be the underlying cause of your fatigue. They usually involve a series of questions about your thoughts, feelings, and behaviors. It's also worth mentioning that sometimes fatigue can be a side effect of medication, or it could be linked to lifestyle factors. For instance, a poor diet, lack of physical activity, or excessive alcohol consumption can all contribute to feelings of fatigue. Therefore, a thorough medical history and lifestyle assessment can provide valuable insights. Unraveling the mystery of persistent fatigue often requires a multifaceted approach, delving into physical, psychological, and lifestyle aspects. It's like piecing together a complex puzzle where each test or assessment provides a piece of the picture. Diagnosing fatigue can be a complex process, but it's an essential step towards managing and treating it. Now that we've diagnosed fatigue, how do we manage and treat it? Let's start by exploring the non-pharmacological strategies. Lifestyle modifications play a significant role in managing fatigue. Regular physical exercise, for instance, can help to boost energy levels and improve sleep quality. It's also beneficial to maintain a balanced diet, rich in nutrients and vitamins, as poor nutrition can exacerbate feelings of tiredness. Sleep hygiene is another critical element in managing fatigue. It's essential to establish a regular sleep schedule, limit daytime napping, and create a sleep-friendly environment. This means removing distractions, such as electronic devices, and ensuring the room is dark, quiet, and cool. Now let's move on to the pharmacological options. These are typically considered for specific cases where lifestyle changes alone aren't sufficient. For instance, stimulants may be used to treat fatigue in patients with narcolepsy. These medications work by increasing dopamine levels in the brain, thereby promoting wakefulness and alertness. It's important to note that pharmacological interventions should always be considered as part of a comprehensive treatment plan and under the guidance of a healthcare professional. Each individual is unique, and what works for one person might not work for another. Moreover, the management strategy should also address any underlying medical conditions causing fatigue, such as anemia or chronic diseases. Treating these conditions can often result in a significant reduction in fatigue levels. Lastly, remember that managing fatigue is not a one-size-fits-all approach. It requires an individualized plan, taking into account the person's medical history, lifestyle, and personal preferences. Managing and treating fatigue involves a comprehensive approach tailored to the individual's needs and circumstances. There's one aspect of fatigue we haven't discussed yet: the mental health component. When we talk about fatigue, it's important to recognize that it's not merely a physical condition. Chronic fatigue often carries with it a significant mental health burden. The constant lack of energy, the inability to perform tasks, and the ongoing struggle to focus can lead to feelings of stress, depression, and anxiety. Imagine always feeling like you're running on empty, no matter how much you rest. It's not hard to see how this can take a toll on your mental well-being. Chronic fatigue can leave individuals feeling overwhelmed, hopeless, and isolated. And here's the tricky part. These mental health conditions can, in turn, exacerbate fatigue. It's a two-way street. Stress, depression, and anxiety can disrupt sleep, decrease motivation, and increase perceived effort during tasks, all leading to increased fatigue. This creates a vicious cycle that can be challenging to break. So, when we consider fatigue, it's essential to assess and address the mental health component. This involves recognizing signs of stress, depression, and anxiety in patients experiencing fatigue. It might mean referring patients to mental health professionals, or incorporating interventions like cognitive behavioral therapy or mindfulness-based stress reduction. And just as we'd suggest lifestyle modifications for physical fatigue, like improved sleep hygiene and dietary changes, we should also recommend strategies for managing mental health. This could include regular exercise, which we know has benefits for both physical and mental health, or encouraging patients to lean on their social support networks. Remember, fatigue is not just about the body, it's about the mind too. And dealing with fatigue means dealing with the whole person, their body, their mind, their life. Addressing the mental health component of fatigue is crucial for a holistic approach to management and treatment. Let's take a moment to recap what we've learned about fatigue. Fatigue is more than just tiredness. It's a pervasive weariness that can impact both physical and mental performance. It comes in two forms: acute, which is temporary, and chronic, a persistent state of fatigue that can be a symptom of various medical conditions. The physiological mechanisms underlying fatigue involve complex interactions between neurotransmitters, adenosine, and our central nervous system. These interactions can influence our muscular and cognitive performance significantly. Common causes of fatigue range from sleep deprivation to chronic diseases like anemia. Risk factors include lifestyle, work-related stress, and dietary habits. To diagnose fatigue, physicians may use blood tests, sleep studies, and psychological assessments to identify the underlying cause. Strategies for managing and treating fatigue can include lifestyle modifications, improving sleep hygiene, and dietary changes. In some cases, pharmacological options may be necessary. It's also important to address the mental health component of fatigue, as it can significantly impact one's quality of life. Understanding fatigue is the first step towards managing it effectively and improving our quality of life.